So that's one constraint. This is relevant because if there are specific questions for now, that's the great thing about folks from Chile. It's a little harder to, I know what time they're leaving, kind of stuff. Always, if you're organizing these events, do not, it's always safer to invite people who are from far away. And so talking about lessons learned, Leslie, that's a pretty important lesson. Distance is, it's inversely related.
We don't change dates.
All right. Okay, so open space, questions, reflections, thoughts, etc. Does this? Yes.
Okay, I'm Suzanne Jackson at the University of Toronto, and thank you for all three presentations. I think what's particularly interesting in the context of thinking about how to evaluate or what to evaluate in equity, the points that I heard from Joyce and Nalini were that it's important to look for ways in which you can measure relationship building or trust building or something down at the community level. I'm interested because the Canadian Best Practices portal is, I'm currently involved with them in creating some of the criteria and the documentation that will put programs on the portal. And there's an equity group that's working on how to label interventions that would be put on the portal as best practices or promising practices that would have an equity component to them. And the criteria, some of the criteria they're coming up with are that communities need to be engaged in decision making in order to get an equity icon. And they need to be, the intervention or the program needs to be trying to reach the most disadvantaged or the least served in the population. But they're not saying that much about building relationships. So I'm just wondering a little bit more about what that would actually look like from an indicator point of view. So that's my comment and question.
Can I take a couple more of the comments and really one second. Do you have a question? Go ahead.
So, hi there. My name is Jonathan. I work at the Evaluation Center. I just have one question. So I am really into participatory methods. So when you get residents, if we're talking about St. Jamestown, or end users to engage. And I'm just wondering, a lot of times we talk about numbers, and those obviously the hardest to reach would not be best for, or maybe not agree or want to participate in groups. So I'm wondering, in your perspective, how you think you could include in evaluations the most marginalized in these types of conversations, because we're all sitting here talking about them, and it seems like the very people would be the least likely to engage. So if you have any, if anyone has experiences about how to do that, it's really interesting.
One more question.
Yeah. So my question is, when you have, so Orielle talked about the heterogeneity of population. So when you have an intervention, and maybe it's a best practice or best, so there's evidence around it, it's been implemented somewhere else and it worked. When you transport it and try to put it in a different context, in different communities, where you were talking about, so are there any kind of principles around how you adapt, or how you, so when you're implementing a program in different communities, even though there's evidence around it, how are program planners changing, adapting it so that it meets the needs of that particular community? So I guess I'm asking kind of from a sort of bigger umbrella, how are programs taking into account what adaptations need to take, and are they documenting that, or are there principles around how you do that?
So, question on relationship and metrics, question on participatory methods, question on adaptation and context. Who wants to go?
I can go. So I'll try to answer. Those are very difficult questions, actually. Just looking at, how do you kind of put relationships into the metrics, right? Broadly, if you think of it, it is a community engagement framework that we are looking at, but it's easier said than done, right? Because what we usually do is, when we mark off those things, is has the community been engaged in planning, and what does planning mean? It means being part of a focus group. Is that what planning really is, right? And those are the questions, right? So are they at the planning table, as opposed to just being an informer in a focus group?
But the examples you gave, not even being involved in planning.
Yeah.
There's another level of engagement. They don't have to be involved in planning.
Yeah. No, I'm just talking from a program planning perspective. Yeah, totally. And to I think Joyce's point and Leslie's in terms of the whole relationship building, right? How do you factor in that criteria? And I don't know. It's it depends. Like you talk about, complexity of care and involving, people. So relationship building becomes part of that complexity of care. Right? So how do you then assess that, right? As a program planner, I do not have an answer for that, right? But there is something in what Joyce said. It's the numbers will not tell you the whole story, right? So how else do you need to capture that story? And I think that's what we as planners or evaluators need to kind of figure out. So that's the one piece. And then to your point, Jennica, around how do you get, how do you hear those voices, right? It's again very difficult to hear those voices, but I think the first thing is the awareness that you're not hearing those voices, right? Just to kind of help you with that. So how can you, with any credibility, look at where are those points where you can hear those voices? So I would say, a simple thing, like if we are looking at, program planning for war trauma, for people who have gone through war trauma, right? You're really essentially not looking for a representative sample of the community, right? So you do not want to hear all the voices, but maybe you want to do a purposive kind of, work with the community, right? People who have gone through, have traumatic past, and at some level might be through another service provider can be engaged in the conversation rather than from a researcher or an evaluator, right? So how do you make that happen, right? How do you make those connections so that you get their stories, you kind of have, might be a session with them, a focus group with them, but with the service provider there, so that and it again kind of circles back to the relationship and the trust building, right? So it goes beyond just, evaluating and hearing those voices in a scientific, evidence-based manner, but actually hearing those voices and hearing what they have to say in an environment that is comfortable to them. Right? And we might or might not always get there. And sometimes you also have to kind of, fall back on, what research has shown you, what evidence has shown you, which is why it's very important to kind of have, that lens as well. That is, sometimes you will not get everything that you want to make your evaluation kind of perfect. So that's, I would say, the other piece to it.
Orielle. If you have any responses to any of the questions?
No, because it's more focused on.
Okay.
I think my answer would be a bit biased the first half, because I have more social workers. Because I think that social workers, when they are in, especially the health sector, they kind of reach that gap between just having the medical support that people need, but they also look at the relational aspect. So, and they go beyond people coming in and going to looking at the different levels of the relationship building. The second part, the second thing I would say is that more workers should go into the hubs. Now there are lots of community centers who have health or social programs. It's quite useful for workers to go in there because people tend to see them. And through that, personally, I've been able to keep track of some clients I've met like 2 years ago, and they only engaged like 6 months ago. So maybe the first contact, I make a note of it. And then after, if that is how to, one way to kind of accounts for the relationship building aspect. I would say that I know it's still difficult, it's not easy, especially when you're dealing with lots of clients, but when you have that engagement, and also attending social events, and as Leslie said, going above normally what you would do. If you have 15 minutes with some of the clients, and because of relationship building, it might maybe take you 30 minutes, because they don't want to come in and just say, oh, so this is your issue. They want to chat. They want you to ask about them. How's your family today, and how are things with you? They can tell you a little bit about other things before you get into business. So to quantify it, I'm not sure how. I don't think I have the answers, but I would say going to the hub and also making a note of the first time you make the contact, and by the time the client finally engages with you, because some of them are not engaged. And so, then also going to the hubs and community centers. With the people who are isolated, Jenica's question, I think the Creating Caring Communities program is one way that if there's anything to learn, I'm not saying that it has all the answers, but because we are engaging people from all the buildings, particularly St. Jamestown, it also means that we are getting access to people who are seriously isolated. Because I wouldn't know, because I don't live in the building, I don't live on the floors, but the people who live there, as I said, who know who they haven't seen for a while, who's not talking to anybody, who's having mental health issues, who is calling 911 a lot. But some people only know about their neighbor when the neighbor calls 911. When the ambulance comes, they say, oh, who is it? And then they all know. So when you go there, they tell you, this senior who is always calling for ambulance, they come and get her. And then one of them said to me, you know, I call 911 because when I don't have anybody to fetch my medication, or if I don't have someone to warm my food or my blood sugar goes down, I'm afraid that I'm going to die by myself. So she calls 911. And then imagine all the apart from the resources that are taken up, which could have been saved for more serious causes, and the anguish and the difficulties that she faces. So involving people from the community is quite important, and also kind of following up, not just going to talk to them once, but making the effort to follow up, maybe every month or two, just check in, how things going, have you seen any new neighbors, or has anything changed for somebody, that kind of thing.
One quick reflection on the
I just wanted to mention one thing that we've seen that was kind of unexpected in our program is that clients may initially get in contact with the STOP program where they're really isolated. I mean, the STOP workers have 9 months to work with people. It might be an extreme clean. It might be, there's all kinds of complex issues. Then they get to our program, and one of the indicators I've realized unexpectedly is this notion of peer support that starts to take place. So from the beginning contact with STOP to maybe 9 to 15 months later, where this person is actually not only attending our program but also supporting others in the program. There's this peer support piece that's happening. To me, that's a huge indicator of success at some level.
Comment on Suzanne's question, because comment with Suzanne's question is, I think relationships is the missing element of most of our evaluations. Emma here and Apurva here, we're working on a project on developing metrics for this very institution. How do we actually study the impacts of this institute? And one of the areas where I think, as researchers, we are awful in studying is what does relationship building mean in terms of any of our metrics of success? The reality is, the whole logic of this building was all these scientists were in different buildings earlier. A few $100 million was spent to build collaborations between scientists. It's a relationship question. Is that actually happening? Was the question that the CEO of the hospital wanted to know. It was a fantastic question. It is quite different from the usual research question of how many papers we've done or how have we changed the world. You name a project, not just a question of relationships, but how is that being used over time? And I think Nalini's answer, I think often, I know as researchers, we game this metric. So as an example, if I had to write a grant proposal for Eastern Korea or otherwise for a training project, I'm going to be saying me and this policymaker are best buddies, best buddies, etc. And we'll get a signature. That is the way we operationalize these relationships. So I think in that sense, the relationship question is quite far-reaching. April, your question about context and adaptation. Mike 3 was sitting right there. A year ago, we worked on a project. We looked at 10 la creme de la creme health equity implementations of intervention. We sort of said, how have they thought about adaptation? Almost, I think for the most part, we don't do a good job when we sort of document our experiences on how was some best practice, or whatever you want to call it, adapt to the specific settings.
Can I just say something on that? So one of the things is that Toronto Public Health has this really great program for women with postpartum depression. And they provide support groups in different community health centers. It has become quite a model in terms of how do you support women with postpartum depression. And we know that, statistics tell us that immigrant women are twice as likely to suffer from postpartum depression, right? So now, Toronto Public Health is looking at how do we tailor. So it is not about just taking the program that is happening right now and offering it to immigrant communities. Women are not going to come, right? So it's about what do you do, what should you do differently. So simple things like access. The access to the program is through a telephone call. Is an immigrant woman who might have difficulties with the language likely to make that call? Is that how different communities connect with services? So, starting there, making psychiatric services available, services of a psychiatrist available, is that the best way to go? Or is it a community engagement model that has to start it off? So these are conversations that are happening in Toronto Public Health right now in terms of, making it viable. And they are really looking at, might be creating a model in the Thorncliffe community around that. So there is an understanding that, just kind of moving a very successful model that works, let's say, with the middle class white community might not kind of cut it for the immigrant communities, but there is a need to say.
It's a very important discussion because far too often, I like where you started, by the way, when you talked about your experience when you first came to Toronto, first came to Canada, and the idea of you need a one-page resume, etc., and you get a job for you in 5 minutes and stuff. Then you have the absence of tailoring. But in a lot of our work, whether it's a dialogue around person-centered care, I don't actually see discussions around, so for tailoring, what kinds of resources are required, what are capacities needed to make it actually serious tailoring. So in that sense, I see with the sort of emergence of person-centered care, etc., I think that I do actually those kinds of discussions. Similarly, I think you use the best practices. I think in the evaluation field, for the most part, the idea of best practice for whom? That's the question you're raising. I think for the most part there's been progress, but I think we still have a way to go to sort of move in that direction.
I need to run. Sorry, I need to leave.
I'm out of here. Other questions, thoughts? Tell us your name, organization.
I'm Sheree, Shapiro, and I'm from Toronto Public Health. And my question is, just to give some background, so I work in the Toronto Urban Health Fund, which is one of our AIDS prevention and drug prevention community resident programs. We're evaluating the program. And I was doing an ethics application. And when I sent it off to my supervisor, he sent me a question that said, well, what if our results are negative? So my question is, in like a bureaucracy or a government where failure is frowned upon, how do you frame failure positively?
I'm also from Public Health, Sara and Farrell. When you were talking about relationships, are we, or can we conclude then that if we find convincing indicators of good relationships, that can be used as a health equity indicator? Yes?
Leave it open, please.
And my name is Heath, Priston. I also work for the City of Toronto, but in social development. And I want to pick up on Sheree's point a little bit as well, but maybe in a slightly different way. it seems to me one of the tensions that's really there is sort of bound up in these last 2 points you have about kind of the focus of the workshop, that the performance measurement piece versus a human rights lens. And some of the work that I've been involved in working to develop a strategy for the City of Toronto to respond to the needs and to the fact that the city hasn't very well serviced youth who are most vulnerable to involvement in serious violence and crime. We've had direction from council to report on outcomes using disaggregated data, which absolutely makes sense, but it also means that we're focused on those types of equity-seeking groups that can be measured easily through disaggregated data, and it sort of undermines the approach that we're trying to take of an intersectional approach by understanding that a lot of the barriers that exist to obtaining service are about the multiple ways in which those identities intersect. And so we're sort of bound up in this need as a government institution to report at that high level around those particular pieces of data, but it almost in a way then pushes us in that direction, and again moves us towards that notion of that awful term of creaming or skimming, or serving the parts of the hard-to-serve population that are easiest to serve, and then leaving the most marginalized people still unserved.
Three great questions. Just to repeat, Sheree's question on how do you change culture, and how do you change fear of failure. Sarah's question, that's great to have progress on indicated relationship, but is the conclusion that we are actually making progress on health equities. Heath's question, and a sort of simplified version, how do we move away from rather gross categories, men versus women, unemployed versus, but look at these conjunctions. So the idea that there are, in those hidden cracks between, is where the biggest problems lie. I'm not just going to turn to the panel, I'm going to have it as an open dialogue, etc. But certainly, Wayne, for example, the third question really resonated with work that's happening in Chile, so you need to let me know. But any reflections on your own experiences? This is where the community aspect comes in. 2, 3 questions. Thoughts? Somebody can go.
Yeah, maybe very short comment about that. Something about the indicator, no? This is general. In the process in Chile, we try to develop some about indicator in relation for equity in social determinant of health. Many times we have to try to analyze the equity. We have disaggregated data about income, gender, and other indicators that we have, rural, urban, but not necessarily for us it's useful to try to understand something for the pathway and mechanism that to try to generate the inequity. At the same time, for us, the more important is to address the social determinant of health. Okay, and in this way, we try to develop to monitor the social determinant of health in the process of Ministry of Health, and a lot of them is outside for the Ministry of Health, no? And we need to try to coordinate for another sector to try to identify some indicators useful for us, to try to see what happened. At the same time, we have to discuss very strong is, well, what is the cause for the health inequality? And some of the time you discuss, okay, this is the distribution of the power, because finally this is a political discussion. What indicator reflects change of the power in the different groups in our society? And this is not easy, no? It's very complex, but at the same time essential, because you are thinking that this is the cause of the inequality. Well, you need to try to reflect something for the power of society. And for me, at the same time, at the community level, because many times we have to engage for the community, the interest is very different, no? And sometimes in our team, in the reality in Chile, no? Sometimes the interest for some of the team is to try to legitimize more some process, and another maybe is to try to help or to try to respond for some coverage in some program, but not really you want to empowerment this group itself to try to influence for the policy. And this is I think this is a challenger, no? Because also we have to, in the system, different point of view, and also different point for what understand for the society, no? But this is the crucial for the discuss. For us, the more important is to try to discuss about this, no? Because many times we have to reflect the role for the people. Many times also the people involved in the Chile, the Ministry of Health is not very open for the participation, no? This is history that what happened, the coup d'etat many times, and not very strong the participation process. sometimes we have a norm for the participation. It's strange, no? But at the same time, the group involved for to more strong participation in the health sector is some group interested to try to some benefits for the health system. But it's not the same that you have involved the group in the society, not direct benefit for the system. It's some for the group for disease, some more chronic disease group, and demand of them specific aspect of them. And it's true, it's necessary, but not necessarily reflects that maybe a lot of them, maybe a lot other groups involved of this. And this is also that we discuss very strong when we talk about engagement community. We are thinking only our program for to try to engagement, or we are thinking engagement society and population in general for to try to move the agenda for the public policies. And I think this is two aspects that.
So my name is Vesna Milinkovic, and I come from CRCT. So I just wanted to reflect on that first question that you said, and I guess the importance of a chain of events, processes, and people that are necessary in order to create a culture of supportive and healthy neighborhoods, right? Because that's what we're talking about. And then, so obviously we do have champions when we talk about people in this chain of, there's a huge need of champions in the community. And from Leslie's story, we heard about certain people. So there is that translation of knowledge that needs to go back from the champions of the community to the community leaders, to researchers, to managers, to eventually funders, in order to be able to tell the story of the community needs. And to go back to that first comment, the fear of failure, once you have funding for a program that will address the needs, we do have motivation that the program succeeds, right? So is the program, or are the goals of the program actually exactly, can we be 100% sure that these are the needs of the community at the time, right? So are there also underlying stories and dynamics and all sorts of nuances that need to be considered within a specific project, within the specific program, right? Does the scope of the program throughout the implementation needs to be changed? How does that need to be changed for us not to fear that we're going to lose the funding, right? So it goes back to that question about bureaucracy and our need to show the performance, that the evaluation is there, that there are good numbers, that we continue to receive the funding, and can we go beyond that and say, well, actually, we think that there are some crucial steps maybe that are being missed, and maybe how about sending a bad evaluation, right? Would that work against us? So goes back into us being able to inform on the needs and being as specific as possible.
Joyce.
Yes, to the first question about whether the relationship building will be one of the indicators of yes, I believe yes, that is important, hugely important, because there's been groups who felt that either because of their socioeconomic standing, they've not been listened to, and nobody really pays attention to them. So I feel that having that, showing and also actively engaging and showing that there's a relationship building is taking place and development means that they have a voice and that they also feel that they're important and are part of the conversation, and they are also represented at the table. So that's what I think.
I just have a few questions for myself. For me, I'll sort of simplify it first by saying the three questions are connected for me the following. as long as we get stuck in the habit of saying, it's a bad linguistic habit, or something, programs work or don't work. They work if the conditions are right, the support systems are right. We have a clue about what's the connection between what we are doing and what we want to achieve. Often, that knowledge is incomplete. Too much of the rhetoric about programs is a pretense for anything we do around here. Pretense that this thing called the program is very well formed, we've got evidence-based for this. There's a certain pretense that we know exactly what to do in a certain specific context. That's, by the way, that's part of what made the Chilean discussion interesting, because they had a year to think about, actually, are we sure we know as much as we do? So for me, this idea of trying to lay out what are the different dominoes that need to fall for our programs to work. Actually, for the current to go through this, there are many, many things that have to fall. So in terms of, your question is a really good one, and I'm in some ways oversimplifying it and being a little glib in my answer, because a lot of the question is not just a methodological one, it's a bureaucratic one, it's the way decisions get taken, there are organizational issues, people have to keep their jobs, all that kind of stuff. So those are all tough questions, etc. But as long as we get stuck into this thing of thumbs up or thumbs down to a program, we're constantly going, but therein lies the problem. And that takes me to the third question, like Sara's question in a minute, is that we pretend our knowledge is very complete, and to the extent that I like asking on day one when we evaluate a program, what are the things you're actually sure about? Honestly, are you sure about it? So like the St. Jamestown one, once we actually began saying, actually, we read your proposal, we read your RFP, you see that? Did you actually know what you're talking about? That's being a little glib, and I need to be. But the point is, all of us have, this is how we lead our lives. We have aspirations. I'd like to be at this point. Often the journey is not that well spelled out. I think in that sense, so connect. Number three is, the third question for me is, often our theory of this, the point Orielle made, our theories of inequities are, so in the evaluation field, we talk a lot about theories of change. For the most part, I don't think we've been as precise about what's our solution theory for inequities. And your point comes in, because I feel like often these categories we create, gender, unemployment, employed, migrant, etc. At the end, I think, as your question suggests, does not have a high level of nuance to it. And I think we need to go. And this is where I think part of my own interest really is in our own work. It's where I'm trying to take the center to. Is often those conjunctions of categories, often the kind of paradox, I think, is often you might need, in a world of incompleteness, data on outcomes first, before you may actually get to some of the processes. So that's a story for another day. I like Sarah's question, because it's connected to answer. I think it depends on how well have you laid out your framework of impact. If you say things ain't going to happen if these relationships are not set. So Lee Cushing, I'm just moving away from equity. Lee Cushing Knowledge Institute is not going to achieve its full impact. Okay? We don't see movement in terms of relationships over time. It's not purely a measurement issue, the measurement is complicit. The question becomes, what are we doing to actually promote relationships? I would not, you cannot mandate improvements in relationships. And this is where Leslie's point is a good one. There has to be joy. There has to be not this perhaps slightly inappropriate definition, but collaboration is an unnatural act between two non-consenting adults. I remember it only because we sometimes speak of relationships and collaborations as oxygen and apple pie. It's not. Life is already too complex. I'd like to keep it simple, including this focus on our work. This idea of trying to, in our own frameworks of how change happens. So I come back to that one. How critical is it that relationships is the fuel of change? As it turns out, I agree, in terms of intent, that is the fuel. We get too caught up, and that's the connection to Sheree. We get too caught up in program descriptions. We need 4 of this and 5 of this and 3 of this, forgetting that eventually, and this is where I think Leslie's Tea Party had it right. It's about relationships. It's about catching the Royal, the 88-year-old, and really kind of moving away as an object of your intervention, or subject of intervention, towards expanding your government itself. So I think those. But anyway, other thoughts from Mr. Leslie question towards more other questions. Other questions. Other reflections. Was there something?
some of the things I kind of observed as I was listening to everybody. And I know funders ask for it, and maybe it's about changing the culture or informing funders on what constitutes evidence-free data for evaluation. But as I listened to specifically, I think it was Joyce speak, and you yourself as well, I think what you were talking about, all the stories that you told were actually evidence of an evaluation work, like, or a program actually working. Because I feel like there's always this like emphasis on numbers, so like how do you quantify relationships and all of those things. And I think, I know funders are often, I know it's important, but sometimes I feel there's a lack of appreciation for those narratives and those stories and the qualitative information that we can gather to be just as important and valid and rigorous data for evaluation. So it's just kind of something I felt as we were talking, but I think, listening to some of the presentations, I felt like that was evaluation evidence, and I think that's something that maybe we should educate funders on, understanding that it might not be something we can quantify, but we can definitely, provide these narratives and stories, and they very clearly, speak to the effectiveness of the programs that we're implementing.
Maybe just to follow on that, Peggy Shultz with Health Nexus. What seems to still underlie, and I've heard it here today, is we talk about evaluation, which is really about learning and about valuing what we do. But always it slips in, the funder needs numbers. And I'm not a funder, and I'm not an apologist for funders, but we're also in an environment where numbers and dollars seem to, be all around us. But how complicit are we also in this? So that, and I know it takes some courage, especially when we're in bureaucracies that demand or expect that we have to show things work. But we kind of get into that mindset as well, and then it's a push-pull, or we try to do two things. Okay, we'll give the numbers there, but really what we're doing is what we've heard today. And so there's somewhere in trying to change that mindset. And it could be that sometimes funders or whoever just don't know what to do either. I mean, so you get in this rut. So it's also asking ourselves how complicit we are, because the system stays in place with those kinds of relationships.
Part of the story here, it would be unfair to make the funder the bad guy. The idea is we are all part of a business, for that to be trustworthy. And I think as long as we so I think the question I want to pose
with what you both said, one of the things I really took upon myself to do is to write as many narratives as possible. And then when some of the funders came into the community, I said, you know what, you have to come around with me. Come, let's visit some of the clients. I asked the clients for permission, and those who didn't said okay to come, and I went with them. And they spoke to them, and they saw on first hand. And I believe that even though mine may be just a little drop of water in a big ocean, I feel it eventually will make a difference if other people join in doing that. Because I made sure that my narrative included when I saw them and the dynamics within the community and the cultural issues that were at stake, and why people didn't want to engage, and how long it took, and what really happened before the people engaged. I made sure to include all of that. Because when a funder gives funding, let's say for 6 months, and you don't have the numbers to show, the irony is that it's rather after the 6 months is when people are ready to get involved, and then it's been taken away. So I just go on and I write lots and lots and lots, and it's been taken. And someone like the CCAC, Camille, who is the lean, I even said to them, could you give her some of my writing? She can, bedtime, she can read them and see some of it.
Jennica. Just a couple of, repeat your name.
Oh, sorry, Stephanie G. from Hospice.
continue. So for me, I think part of the question on, I think sometimes, and Peggy's point too, I think this qualitative versus quantitative is not as important to me as much as I think our stories are rather poor in the way we actually sort of tell about what our programs are doing. I don't really care how you tell the story, but and sometimes I would say some of our qualitative narratives too, by the way, leave a lot to be desired. Stuff too, so I'm not giving anything free right here. But I think the best story I've heard about inequities was a friend from Glasgow, from the Glasgow Centre for Population Health. She talked about something called, the story was called David's Story, where David was a 12-year-old kid, or 13-year-old kid. The actual presentation starts with him, actual video of him knifing a few people on Friday night in Glasgow. And it's an incredible moment. He's sentenced for a few years. The story starts by mapping out David's life. So there's literally this, just a figure. So this is what happened to David at age 7, age 8, age 9, age 10, age 11, age 12. And this is there's an x-axis from the bottom. This is what's happened, events that happened. Then she shows, let's see how the system responded to each of these itself. And just on one graphic alone, you kind of realize, oh my gosh, this will be a miracle. This is a horrible system. I mean, I've heard so many stories on coordination and problems like that, but never seen a story of what a coordination failure looks like. In a simple graphic. She goes further. She says, actually, let's look at David at age 12. Let's look at where he was living. So they actually take, so they obviously sort of changing a few stories. They show where he's living. They show whose neighbors were. They show context. And then she goes back and looks at age 10, age. And so not only is a coordination failure in terms of time, there's an incredible coordination failure in terms of context. And so the idea, I've read 1,000 different reports on coordination failures, etc. I've never seen a simple, eloquent presentation of simply saying, this is the generative mechanisms of it. It's something that each of our reports we can produce this afternoon. We don't tell those kinds of stories. For me, Peggy's comment, and I think, and this is kind of important, we sort of think about these issues, and I like the way you framed it, because it's not about the funder writing checks. That's not fair. I think what's not clear to me, and I think, Sara, your questions, for me, came closest to me. The problem for me is inequities. We know fully well we're not going to crack the St. Jamestown problem. We won't frame it as a problem in 2 years or 3 years. No evaluation in the world. I mean, the program, and I think the last bit you said, I think the paradox of most things in life is you get the hang of it just when it's about to end. So, and that's what learning means, by the way. That's exactly what learning means, etc. So this is not that paradoxical. So your question hints at the idea that in actuality, if it's true, the relationships are critical for change to occur, and relationships don't happen overnight. So often when you write a proposal, etc., you're not going to be getting the proposal if you say in 2 years from now we build relationships. You're going to be this often promising the moon. We'll see these often in the Toronto, in the Ontario language we'll be talking about waiting times and our favorite outcome today. But in the health equity language, so I guess my question to you would be, and I think Peggy, your question comes close to this, is really, what is because we've not talked about sustainability. What's an evaluation? My reframing of Peggy's question is really, what's an evaluation? If it's true, that these are long-term processes, health equities didn't get bad overnight, you're certainly not going to solve it. You're not going to solve St. Jamestown problem in 2 years, etc. Even the Chilean example, where you had a fantastic, progressive, enlightenment leader there, that gets truncated. There are political processes, etc. But what's good is they stay the course. But the much more sort of precise version of the question is, what's a thinking of, I like the way you frame it, whether you want to call it learning, whether you want to call it monitoring, whether you want to say some way to study progress. But we have to be honest that this is not a process that can change in 5 years. Maybe the best we can achieve in 2 years, to frame your question, Sara, is really a change in relationships. And so moving and coming back to Peggy's language, in terms of not becoming complicit in constantly promising the moon in 2 years we're going to see these following 5 indicators change, is that part of the solution. But any successes you have by actually moving towards a much more honest system of accountability, honest system of accountancy, saying actually no, relationships have to fall first, then we worry about the other things. Any experiences from you?
I just wanted to comment on the story, and I so appreciate what you're saying. It's like, it's the piece that's missing in what we do, and I really appreciated that story about the 12-year-old, because when you're trying to engage isolated seniors, they have like 70 or 80 years of disconnected coordination, so to speak, or interjected. I mean, it's just like it's so many years of challenge from so many different angles that that's the issue, that you can't. It's not just one conversation, come to our program, you're going to love it. It's so not that, because you almost have to sit and put in the time to listen to those 70 to 80 years of what hasn't worked in order to engage. And I really, that is such a good, it's a great example of how to document for funders, I think, that trajectory over the 80 years, all the different kind of interjections that have taken place that really haven't worked, which is why they are where they are.
That's right.
And it doesn't unfold quickly by offering a program. It's like so not that.
Because I think what's good about this conversation is I think we can do a better job doing what we do in terms of documenting. It's kind of like you Joyce, your problem, Lord. It's a very steep climb. I think we've got to do a better job of bringing realism in. And by the way, every single funder we work with actually has time. They may start off with a very aspirational, show us the moon stage. But I think I found actually incredible room, so to echo Peggy's point, for dialogue towards getting realism in. Sarah, you had your hand up.
So if health equity is the moon, are there, in all the research that you come across, are there any more short-term indicators that we could say, for example, if we can prove that the people in St. James Town are more civically engaged, for example, does that... I'm trying to make and you think, okay, is that convincing enough? Is there a clear enough, almost like cause and effect, if you have increased civic engagement, if you have increased community engagement, or are there any more concrete indicators beyond like the social or demographics like income and all of that kind of piece? Are there any more creative or softer indicators that as community workers we can play with to actually make the case that we are contributing to addressing that engagement?
I think that's a good question. Question. Our response to this. Peggy.
Okay, go on. I've been talking.
I don't know where to introduce this part, but it feels like we feel like our evaluations or our indicators are proving that doing A, B, and C and community development and relationships will do something, and if we can just prove it, then there we are. And so there's something in the ideologies and in, because my question would still be that, given programs and services which are so important, what about the inequities that cause even the need for some of those in the first place? Because communities aren't asking for more programs and more services, there's something else. So there's a whole range of beliefs, mindsets, and power that all the evidence in the world, because to be truthful, we've got the evidence. So it's, I guess maybe that's asking the question that came through before, which is, what is the evaluation for and about? And is it about proving something?
Jennica.
It's just something when we talk a lot about things. I think when you're trying to address the most marginalized people, no one can talk about like the power dynamics that are kind of innately there. So one thing I'm questioning is as service providers who are providing care, you're kind of put in a powerful position, and often health equity programs don't include aspects that ask the service providers to change. Like we're asking the most marginalized people to change and not asking the same question. So I'm just wondering, are there metrics
for ideas of success to encourage that type of self-reflection. And I think I really heard through Leslie when she was talking about her program moving from the table to the front, like that involves like self-reflection. And I'm just wondering if there's measures to promote that.
Yeah, in response to what you said, for at least for some of the programs are happening, one of the advantages of at least for the St. Jamestown community now is that the engagement and working with other groups, and thankfully some of the funders have been listening, is that now we have more collaborative programs. That is why Leslie is from another agency, but I work together with her. So that, because now when we find an isolated senior who does not engage before and they have mental health issue, Leslie's group may have just worked with them for 9 months and they will move on and they will be left there by themselves now to navigate the healthcare system, which is very demanding for someone who is a senior and is having lots of complex needs. But now, because we have a collaborative program now, where the funders have allowed us, as a 3 agency, we have a program. So when I'm helping a senior with the psychosocial and aspects and also linking them to healthcare resources, in the daytime, Leslie's group will have someone who will go to the senior and help them come and be part of the day program. So they spend 3 days with other people. So it's becoming involving more people. And then also some of the soft indicators, we have women who now, mostly women, there are a few men, but mostly women because they're the caregivers and for their children and their families, who have become involved with the programs. And they meet with us frequently. And I run like 4 groups, the Nepali Women's Association, the Tamil Seniors Association, the Filipino Association, big groups. And they, at the helm of things, they say to us, we want someone from public health to come. When we talk about resources, they say someone to come and talk to us about healthcare on things like, how do I know if a family has mental health? Because some of the indicators I'm hearing are different from what I know from back home. Or maybe we want information on someone to come and talk to us about finding jobs, or how maybe my language skills, English language skills are not up to the scratch that the agencies are asking for. Are there other ways that we can get that support? Or bring in a speaker who will come and talk to us about different health. And we've also had to put together a healthcare resource handbook. And that is what people have. So they don't always have to call a worker. They can tell their neighbors. I know people wouldn't call telehealth because they said, oh, as soon as I call telehealth, they say, how old are you? And we say, well, there's a reason. So they will know if they hear your symptoms or whatever conditions, depending on your age, they will be able to advise you. Because some people say it's irrelevant for someone to ask my age. So all of that, people are becoming aware, they're feeling empowered that they can come and say, this is what we want, we don't want this, or we don't want that. And even if a worker, if they're happy with a worker's approach, they will tell other workers that this is the approach we're looking for, or this is not the approach we're looking for. In some of the community leaders, there are issues there within the communities, but the cultural group, some of the leaders are very vocal, and they will come and say, you know what, this is what we think is working, this is not. So it is very, for me personally, I find it comforting, and also thinking that we're getting somewhere when people feel able to come and say this is what they want. So those are some of the indicators that I probably can't document, but they're happening.
So, Sara, what I love about your question is really, for me, for one, just looking at the team here, should be part of a follow-up discussion. This is sort of a cop-out answer. The less cop-out answer is, I think it's important we don't, it's not the way you're framing the question, but it's important that the answers to this question are not framed in too narrow or programmatic lens. Often that question is framed, this is my program, I need to show success, etc. And because the answers to that question, if there were any, undercut the intersectoral approach, which basically argues it's not just your program, it's your program in connection with a bunch of other things, sometimes across sectors, sometimes within the same sector, that brings about. The causal agent is your program might be a necessary condition, by itself as well. So this idea that the program itself has the power to bring about those changes. So again, as part of seeking out a landscape answers to that question, sort of seek within an intersectoral approach, to see what are those connections needed, etc., etc. At the end, this is where I have the comfort of sitting in my office and say, even if they're not very clean answers, here are the 4 leading indicators, etc., etc. We map out actually that it's a pretty heterogeneous space. These are some things that go with this kind of space. But I think it's a good question framed in an extended dialogue. We've time for one last question, if there is any. Do I see you ponder a question?
Yeah, maybe. Some of your stories, Joyce, and I think Orielle as well. I'm Donald Cole, sorry, of the Pandalangat School of Public Health, and speak to that there are different things happening, if you like, at different organizational or structural levels. That some of what you describe is very much sort of a dyadic engagement of you with individuals and how that proceeds over time. Others of it is among small groups. You just talked about particular cultural groups that come together and then they generated dynamics. Another is your relationship with multiple agencies, supported by funders, LIMS, etc. And I wonder if we could talk, and I think it's quite important. I mean, when Orielle, you presented the piece about the red tide and all the social actors involved in that and the different ways people can go around and how might be the process of organizing and documenting all those things occurring. I think sometimes we forget that each one of those changes, I mean, it's partly about the context, but all those changes kind of happening simultaneously. So your narratives are kind of, that dyadic narrative is kind of a bedrock. But then how do you keep track of all the other things happening? And how do you kind of package it? Do you know what I mean? As part of an evaluation.
Yes, I think that if you leave the small details, then we're missing the point. I feel that because personally, I think some of the difficulties we've been having, the challenges, is because people look at the top and they don't look at things from the ground up. So I think that if we, Leslie's here, Leslie's from CRCT, and there's people from Progress Place, and we have people from different agencies working on the ground. What we've done over the years, we've learned from our strengths and our weaknesses as workers and also as agencies. So we realized that it would be better for clients if we worked, in collaboration. So that instead of a client telling their story over and over, after talking to me, they have to talk to a nurse, a doctor, and everything. When we work collaboratively, instead of one person going to do with a group or a client, we go now as a group of partners and different agencies. So we help them navigate whatever they need to do without personally having to do that. So from the ground up, I think that looking at the individual and then the group, the family, and then raising it to a larger scale gives the real story. Because the story is essentially about the individual, and then it goes to the family, and then it goes to the community, and then the societal level. So looking at that, there's surely evaluators and the funding agencies and they so probably have their ways to put it. So I wouldn't say that I would have all the answers, but I know for sure that if you forget about the list in the community or somebody who, or the groups, then it means that we're perpetuating the cycle of what makes it worse in the first place. Why some of the challenges are there in the first place? Because some people are not mainstream, well-educated, middle class, or having all the right language skills and all the necessary things that is used as the normal ways to measure or to engage in community. So these are the people, and we are part of all of them. So also moving the language from they versus us, is all of us involved. So from that point, and then moving on to a level where it will become, look at the bigger picture. But it is all the small components together that will give us the real picture of what is really happening. That is what I believe is happening. And I don't think that it's all, there are lots of, we've been talking a lot about the challenges. I'll open up in 1 second. I know we've been talking a lot about the challenges of quantifying results and getting the numbers and how do we really address this, but there are lots of progress happening. And personally, every week I walk out and like Leslie and the rest of us thinking we've made a huge difference. I wouldn't say small difference anymore, because somebody's life could have ended if we were not there. And I think that is a huge difference. So we always leave there thinking that we've touched the lives of 20 people, or people who may have been statistics. They will be counted as, oh, this person died in the room, or they didn't get access to doctor, or there was somebody there to give them food. But we make sure that there's coordinated efforts. And people who didn't have anybody in the community will liaise with. St. Michael has been fantastic. As a hospital, they always involve us from that level too. So that is.
Yeah, very short. Yeah, another 10. Yeah, no. I think the point is the work in another sector, no, the intersectoral action in the high level. It's very different from the local level, no. In the high level, you have a lot of the discussion for the power and the resource, and many times it's more difficult to try to move the agenda, no. In the context in Chile, they discuss which they address the agenda, the social policies or the economic policies, okay? And this is all time for the discuss, no? And sometimes you have the window opportunity because it's open, not necessarily from the economics perspective, the people open for to try to social policy address all the agenda, but they open for to try to find some solution for some problem. I remember some example for the waiting list in the health system. And this is the main aspect that the people thinking about how to try to move. And then we discuss with them, okay, we have to put a lot of money all time, but necessarily again we have the waiting list. And also we have not satisfactory for the people approve about of this. And we need to try to move another way. And in this setting, they open for to try to finance, for example, some program for neighborhood, for to try community, and send for the county vulnerable to try to access for the system, no? And this is in another discuss. It's never discussed the center, this aspect, no? This is one example that to try to explain. And when in the local level, in the process for the redesign the program, we have the central level, a lot of them sometimes very vertical, but at the same time we have process for the redesign the program into regional, okay? And they development in another way, something similar but not necessary. All the time we have the discussion about, some of them we try to harmonize it, all of them, because it's more easy for the Minister of Health to follow up. It's all the people in the same way, yeah, because it's easy for to try. But all the people in the regional say no, because we have specific context in our country, and maybe we need to move another way. And this is the balance that to try to harmonize it, all of them, but at the same time, you need to respect for the context and the specific reality that you have to follow up of them. In this way, we developed something for intersectoral action, and in relation for the indicator, no, short time. I think this is very specific for the program, no? If we want to try to publish in a statistics report for the Ministry of Health, yeah, maybe it's another way. But if you have to follow up the process and what happened in your program, we try to identify the type of intersectoral action useful for the pro-equity. Okay, and we define something for the content, something for the orientation, and some for the type of the relation between the sector. And we try to identify something of them, and maybe try to follow up what happened, no? Maybe not necessarily you see direct impact for health equity, but you are thinking that this is the mechanism that what happened for equity. If you follow up in this way, it's useful concretely for the manager for the program, okay? And this is the mechanism follow up, and this is something that we develop in some metric, and there are a lot of the, one in Spanish, no? But there are a lot of the systematized all the work that we make in this period, and after also publish some of them, no?
Yeah, and when we met with Sanjeev and Jennica, one of the things I said is I hope that this is not just an academic exercise. I know academic exercise is important because that's how, but however, back to your question, my hope is that people like yourself, evaluators and policy makers, will take into account all the little bits and have a more holistic approach and look at things and see the connectedness, and not just think that maybe this is that way and this is that way, and but that it will eventually help put programs in the right, give funding for the programs, and also help see that it is not just numbers, but that it's more complex.
Okay. Just one final thought. I think with Sarah's question and Donald's question, I think we need better stories of transformations in both the individual lives as well as transformations at systems lives. I think too often you're too fixated. We start with that program and we sort of seek out how does this program work, or rather actually see that lots of changes are happening here. Let me first sort of say thank you to Joyce, thank you to Orielle, thank you to Nalini for coming all the way and really sort of interesting dialogue. You can tell because it's class, we're 10 minutes past the time. So I think it's kept us engaged. I also felt that discussions were absolutely exciting. I didn't necessarily expect clean answers, so whether it's Sarah's question about what a leading indicator, etc. One of the things we're trying to do, for the most part, we're taking the summer off in terms of these workshops, but sometimes September, October, we are planning some version of a fall evaluation school. So the idea really, some of the questions that were generated today gives us ideas of how we would like to pursue who are the folks that we would want to be doing, etc. So that's two. Thank you to my team, Jennica, Nichols, who's coordinated all of you, and thanks very much for making it happen. For all the organization.